Hey everybody, Dr. Red Cross here. We are on part 3 of the patient-doctor pain points. Number 3, not understanding medical jargon. So this patient says to me, I nodded like I understood, but I have no idea what they just said, and I'm supposed to figure this out on my own. Well, this patient sounds like so many that go through this sort of thing. So, that thing about the medical jargon and so forth is so important for us to remember as physicians. So like I said, you are not alone. Now, when you're thinking about what the doctor's trying to convey, I think sometimes docs are wanting you to know that, hey, we've done a lot of training. I've been doing this for over 20 years, and it takes about 10 years to train to be a doc when you stack it all up. So sometimes I think docs kind of forget also that the patients that we're dealing with didn't go to medical school and need to be very cognizant about that and sensitive. The other thing that I think is important that we as physicians need to remember as well is lots of times patients are afraid and they're scared. And so that's the thing I think about when I try to break things down. I always say I try to break medical things down into little digestible pieces, right? So that you can take that in and not only be not afraid, but also understand what's going on. Now, the other thing we've talked about with some of these other things is not being afraid to let the doctor know that you didn't understand that word. One of the things I do as well when some of the words are longer or challenging, like for instance, when I worked in Puerto Rico, there was a question of, and I love Puerto Rico, claro que sí, ¿verdad? So if you speak Spanish, we can talk about that too. But I love Puerto Rico, but there was a disease that we didn't know if the patient had, and we were dealing with called chikungunya. Chikungunya is an infectious disease or what have you, but the point is, when you have these long words in medical care, you have to slow down. I'm talking to my docs here, my medical professionals, but then I'm also talking to you, the patient now, is that you need to be able to slow down and say, I didn't really process that word, and don't let it go by. Like this patient was saying that she didn't understand, but she nodded like she did. You should never have to do that. Remember, this patient-doctor relationship isn't necessarily a long one when you're coming in to be seen by the doctor. So you need to get value for your visit. And the last thing you need to do is step out of that office without understanding each and every word that was there for you. The other thing is, I always like for patients to ask questions. In other words, you know how at the end of the visit you get this post-visit summary and so forth? I know we're all busy and you may be doing other things, but I like to have patients review those sort of things. And when they can review that paperwork, they can come back to me with actual questions and so forth. I also like to make sure that patients are educated throughout the visit. And so I'm telling you this because when you're with your doctor, you're dealing with high blood pressure, or if you're dealing with congestive heart failure or COPD, chronic obstructive pulmonary disease, doc, help me understand. I don't really get this thing. I know they told me I have this COPD, but what does that really mean? So in other words, think of this as an opportunity for you to be educated, because as you become more educated on the challenges that you may have and so forth, it allows you to learn medical words. It allows you to understand not only where the doctor is headed, but not to be thrown off with these words because you've heard them before during certain other visits and so forth. The other thing that I talk to patients about to help with the medical jargon thing is when you are with your doctor, maybe you can even have a friend or a family member come with you. I say this because you hear different things. Sometimes the word that you forget, your friend or relative will help you remember or will also know that word. So when you're in a place, when you're with a medical professional who may or may not get it at the time, another set of eyes and ears, I think, are incredibly valuable to make sure of that. The other thing is, if you're having this challenge and you keep going to this doctor and they're not listening, which I don't think you should have a big problem once you tell the doctor, hey doc, I didn't get that. But the point is, then you need to have a little bit more of a sit down and see if this is actually the best match for you at this time, because you just don't feel it there. You just don't feel like they're engaging enough to say, Doc, I've asked you to slow down. I kind of don't get this. Because unless you're educated on what's going on or understanding some of these words, how can we take good care of you? How can you feel like you're being well taken care of? So unlike that patient there, I don't want you to feel like you're a slave to that particular interaction or to the situation. I want you to feel like you're able to really participate and be a part of this, okay? So when you hear all that medical jargon, hold on, Doc, slow it up, bro, or gal, or bro or gal. Anyway, you know what I mean. Slow it up and let me get on board with you, all right? Take care. Hey everybody, Dr. Ken Redcross here. If you don't know, I love the patient-doctor relationship. It is so important. So my question for you is, who wants to live longer? We all do, right? So therefore I've written 2 books. This first book is called Bond. It's the importance of trust, respect, empathy, and communication with your doctor, because I believe if the relationship is perfect, then it will help you live longer. But how can I really make sure you live longer? Well, I decided to write a second book. This is the 15-minute Bond Blueprint. This particular book helps you go minute by minute of your 15-minute visit to make sure you get the perfect doctor relationship and visit that you all deserve to make sure we extend our healthcare journey.